Okay, welcome to talking about this year's IAACD listening and sharing session. Really excited to be having this year's session on the 7th of November. And our topic is moving into adulthood, finding and navigating support pathways. I'm really excited today to be talking about what some host countries are thinking about doing and what they'd like to share with us. So Dorcia, would you like to tell us about yourself and your thoughts about moving into adulthood?
Yes, my name is Dorica Dan. I'm living in Romania and I'm coordinating Romanian Prader-Willi Association and Romania National Alliance for Rare Diseases. I'm a board member of EURORDIS, European Organization for Rare Disease, and I'm a colleague with Kasia as an IPAC chair in ERN Ithaca. I'm involved in this field because myself, I had polio when I was a child, and I was struggling through rehabilitation and integration. And I have a daughter with Prader-Willi syndrome, and all this make me very interested on this topic. My daughter is already adult, but it was not easy, the process, and nobody knew how we can find the right services at the right time when we move to adulthood.
That's so interesting. And do you feel like there's been a shift in services, in the past few years, or do you feel like that's still an issue that needs to be discussed?
I think this is an issue that needs to be discussed in the next coming years because there are no miracles and we have to adapt solutions to the national and local context for everybody. And in Romania, we face challenges in transitioning rare disease care from pediatric to adult services because we don't have protocols. There is a limited coordination and resource constraints. And there is no legislation framework to solve this. So we had some experience last year with a Duchenne young person that moved to adulthood and needed care in pediatric hospital in a center for expertise for his disease. And according to our law, he could be hospitalized, and he was hospitalized. The problem was that the services and the care was not, they could not reimburse the care because it was not, the legislation was not continued with the implementation phase. So we introduced in the legislation, but the implementation process was not finalized. And we realized that we still have a problem. And also Doctors Collegium told that the adult neurologists have not the knowledge about the rare disease, about Duchenne, and they need to be specialized in different diseases, which is quite complicated. And I think we will all talk about this transition topic for many years from now on. And it is taking into consideration that's the new thing that is happening comparing to my time of adulthood, transition to adulthood. I think there is a lot of discussion around the topic at different levels in different contexts. At European level, we are talking a lot about transition in different European reference networks and in centers of expertise at national level. So I think it will be a change to the positive in the coming years. Yeah.
And I think that's really interesting that that shift has taken so long and it's really just picked up the momentum now. I think across the world, what you're saying to me is what we're seeing, I'm in Australia, but I'm from New Zealand and it's the same challenges. So really interested on the 7th of November to have our listening and sharing session and hearing all of the ideas from across the world. So I know you're hosting a session in Romania, but if we have people listening to this and they want to know what things should be discussed and what are important topics within this moving into adulthood, what would you suggest to them that we should be thinking about?
So I think one of the most important thing is to find the right human resources that could be involved in care coordination. And in our case, we are trying to solve this problem for the last years, working to train community nurses to become case managers for people with rare diseases. But we need also to hear more about the challenges that the patient have encountered through this period. This is very important learning from these challenges. And I hope that during our session and other sessions to find out more about the challenges and maybe from others to learn more about how they solve these challenges. I think it would be very important to follow all these discussions this year.
Yeah, that sounds really great. So, one, we're going to learn from each other, but two, also, we want the voices of young people and adults who have disability who have been through this process, the positive and the negatives of that, so that we can learn from them and also learn from other services and policies. And it's like you said, it's at the child, young person, adult level and family level, but right through to policy, isn't it? So, yeah, I think that's super interesting. Well, thank you so much for sharing your thoughts. We're really interested in what's happening in Romania, and we hope that we can join lots of sessions together on the 7th of November. So thank you so much.
Thank you very much for inviting me, and I'm very happy to do this and to follow all the process. Thank you.
Wonderful. Thank you.